One of the first things you're going to notice as you sit back in the chair is we're going to be looking at a health assessment of you first. When it comes to the dental health checks you're used to, the 4 things dentists will generally look for are tooth decay on the teeth themselves. That's between the teeth, on the edges of the teeth, and on the biting surfaces. One of the ways of doing it is using a mirror and what we call a dental probe. We're looking for any destruction from sugar in our diets combining with the bacteria. Second aspect is gum health. We are using a screening tool to score you from 0 to 4 to see if you have any effect from the gums becoming worse in their socket and the bone softening. This is how we lose teeth, and it's a super important step. Third aspect, tooth wear. We're asking ourselves, are you wearing your teeth out faster than someone of your age? Fourth aspect, oral cancer. A very dangerous condition, but also quite rare. Are there any lumps, bumps, or patches that show sinister signs that need onward referral to a hospital to investigate further? Following on from that, we can look at the cosmetic and aesthetic side, which we look at in a slightly different way. We're starting with a bite and joint diagnosis. What I mean by that is the joint that opens and closes our bottom jaw, is it healthy? Are there any clicks? Are there pains that are potentially going to impact any dentistry we plan or comfortability you might have through treatment? Moving on from that, we'll look at how are you using your teeth? Are you using them in a way that's causing a destructive pattern or an avoidance pattern that might be causing increased wear on the teeth, increased breakage? The next aspect is what sort of dentistry have you had done on other teeth, and has it predisposed the teeth to structural damage? Structural damage comes in different forms, and we use a barrage of tests to identify if a tooth is under increased load or not. Is it liable to further breakage or fracture? Does it need support? Tooth positions. There is a series of factors we can look at to whether your teeth are in the technical correct position for your bone structure and face structure. Based on that, we can look at, is straightening the teeth with braces or alignment going to help you? The next aspect is the gum positions from an aesthetic point of view. Pink gum level around the teeth should sit in a certain level from the front to the back of the teeth. Some of the factors we can include are, how do the teeth sit aesthetically within your lips? Are they in the aesthetic ideals of what we would like for you? And that's a subjective assessment.